So Health Pathways is a system that we've introduced into primary care and the community services. Last year it went live, and we're in the process of introducing the Hospital Health Pathways project into the hospital trust. So Health Pathways is a system that was designed in Canterbury, New Zealand, to help support integration and support their workforce when they were in a situation of great challenge, which we can all recognise and empathise with. And what it is, it's a product, it's a website that houses localised pathways of care, condition and symptom specific, to help support the clinician in their decision making and their investigation and management of patients. But it's local and it's timely. So what that means is that primary care clinicians, community clinicians have access to a range of pathways to help support their management of patients based on what exists for our patients in North Cumbria as of today. So if I have a patient with heart failure, I know that where I can access tests, what tests I should be accessing, where I refer, how I refer to that patient as of today. So it helps make my life as a practicing clinician easier. It helps reduce fragmentation of care. It helps improve standardization of care across all clinicians, because we have that one place of information to go to. As a primary care clinician, it can be very challenging trying to keep on top of all of the guidelines and all of the resources out there to help support our patients and to help support our decision making. So having Health Pathways gives us one place to go to for that information. It's also a really useful resource to house patient information, so we can start to standardise the patient information that goes out to individual patients about their condition or their symptom. And we're working with third sector as well. So we're starting to bring together all of the third sector services in the pathways that we have access to. So we know if we have patients with particular conditions, if there are third sector resources out there that can help support us and them. How we do it is we have a team of clinical editors in the community health pathways. It's a team of GPs, and in the hospital health pathways, it's a team of doctors and nurses. And what they do is they bring together the current up-to-date evidence, they bring together other pathways that are in existence, and they sit down with a relevant subject matter expert. Could be a consultant, could be a physio, could be a specialist nurse, and they have a chat about what happens for our patients in North Cumbria as of today. And with the information from the guidance and with that information from that discussion, that's how the pathway is developed. So it's very, very localised and it's very, very up to date. Part of the process in developing these pathways can identify educational needs for primary care and community services, or it can identify areas of the system that we need to work at and improve. So Health Pathways starts to become, as well as an excellent resource to support clinicians, it starts to become a driver for quality improvement in the system, either through education or through service improvement and service redesign. It also becomes an opportunity for bringing services and bringing people together and helping with integration, because these conversations about the pathway happen across services. So as I've said, third sector, but also what can community services offer, what can hospital trusts offer, what can primary care offer. What we've learned as we've gone on is that it's an excellent system and that people are grateful for it and that people are increasingly using it and increasingly finding it useful. We've developed lots of different service redesign issues based on the pathway discussions, and our education programme for primary care is also very closely linked in with Health Pathways. So we educate and then we have the resource for clinicians to look at later through the Health Pathway. It's helping to support our more temporary workforce as well, such as trainees or locum doctors who are working in the area, because they know, based on Health Pathways, this is how things are done in North Cumbria. So it's helping with the flexibility of the workforce and reduces some of that different processes that can happen with temporary staff. The benefits to the patients are improved care, more streamlined care, more awareness of what we have available in North Cumbria, both within the health service and within the third sector. Standardisation of care, so it doesn't matter if you're being seen for a condition in Whitehaven or Penrith, you'll still get treated in the same way, because that's the pathway of how we do things in our area. Hospital Health Pathways is just in its infancy, it's just in its development phase, but it will do the same process for within the hospital. It will help support the junior doctors and the doctors who work within the trust in managing the patients as well as looking at that interface between how primary care and secondary care and how patients flow through the system. And it works in a very similar way. So we hope to see the same benefits occurring in the trust as we're starting to see in the community from health pathways. This is a long-term project that is here hopefully for a long time to help support primary care and hospital services, and I look forward to seeing how it's going to develop over the next few years.